Let me introduce you to my audience. I'm talking to Dr. Kris, the ASCO Cancer Communications Committee Chair. More than 30,000 of the world's leading cancer specialists have come to Chicago to learn about the latest advances in progress in treating cancer. And Dr. Kris, could you tell me what's going on behind the closed doors? What's happening at this annual meeting, please?
Well, I'd like to open the doors right now if I could and share what we've learned. It's just been an amazing meeting. You know, we have all work here. We're all cancer researchers, and we also care for people with cancer at the same time. We're always trying to improve upon the care that we have. And this year's meeting in particular has highlighted and presented to all of us many developments, and ones particularly for the tough cancers, the smart cancers, as our president called them. There's a kind of skin cancer called malignant melanoma. It is one where the treatment really hasn't changed since 1975. And the 1975 treatment helped only a minority of patients. It also had a lot of severe side effects and just, didn't do the job, not what we wanted. And what we saw yesterday was two new medicines were compared to that 1975 standard, and it beat it soundly. And it did so with better results and in general, a better life for the patients. The other thing that came out of this work, these two new treatments are not variations on the same theme. They're very distinct. They fight the cancer in a different way. So there's the immediate possibility of doing them together. So the hope is, the benefit of both will be combined and hopefully even extended. And for a cancer that was really one of the ones where we needed a lot more hope, and we got it yesterday. We've also seen in a lot of different cancers here, a lot of different kinds of cancer, that if you take the cancer tissue, analyze it when the cancer is diagnosed, you can use that information to better choose a treatment for a patient. I had the opportunity to present the results yesterday of 14 hospitals across the country that are working together to take the tumor tissue from patients diagnosed with lung cancer, analyze that tissue for genetic changes in the cancer, not in the person, and use that information to treat the cancer. When you would use a standard chemotherapy, it helps about a third of the patients by shrinking their cancer. If you find a certain genetic defect, and if you then treat the patients with that defect with a specific drug for it, 3/4 of the patients have benefit. And that benefit also comes from using tablets. People take one tablet a day instead of the usual kinds of chemotherapy, which, while helpful, are a lot more difficult to take. More visits to the hospital, more issues of lessening side effects, administration. So the fact that we can get this information, use it for people, make better choices for them, give them more options is just a great message here. And this is happening in a lot of different cancers.
And how soon might the patients see these actual findings in their everyday treatments?
Today. One of the drugs for malignant melanoma, the ipilimumab, that drug is available today in an oncologist's office across the United States. And the other one, the vemurafenib, I know these are tough names, that drug is under FDA review, and we're very hopeful it'll be in pharmacies in just a few months. So these are not pie-in-the-sky hope for benefits. They're there in the doctor's offices right now. And I'd encourage patients to go to our website, cancer.net. We've tried to highlight all the developments here for all kinds of cancer, not just the ones I spoke about so far. Look for things that would be helpful for you, get the information you need, and meet with your healthcare team and see about getting these treatments. The other one I mentioned with lung cancer too, the erlotinib treatment, if you have a mutation in your tumor cells, that's available throughout the United States and throughout the world today.
And I'm asking this on behalf of people who are first diagnosed with cancer. It's been stated that the survival rate is increasing, but doesn't this depend upon the type of cancer? I mean, can you speak to this?
Sure, it absolutely does. The survival rates for all cancer are increasing. One interesting and wonderful fact that came up at the meeting, there are 12 million cancer survivors in the U.S. right now, and that number is growing every day. I think it's important, though, to see what can be done for your cancer. Another part of that message about testing tumors and about finding specific genetic changes that make your cancer grow, it gives doctors a much better way to estimate what is your prognosis, and also gives your doctors a much better way to choose the treatment that's right for you. And the results that we see here are really much better when drugs are chosen based on an individual's cancer. So while you get all the information you can about your kind of cancer, but you need that fine-tuning that can come from these genetic tests on your tumor, and that's something you need to talk with your doctor and your healthcare team about. And by the way, these tests are available throughout the United States. This, too, is not something done in only a few research labs. I mean, your doctor has the capability to send your tumor specimen for this kind of advanced testing today.
And I'm asking a layman's question. What have you learned about the relationship between genes and cancer? Don't some people have more of a chance of getting cancer? People always wonder that.
Yeah, they do. There are some very specific kinds of cancer that run in families, but the nice thing about doing this genetic testing is you can find those causes, and there's particularly one in breast cancer, the BRCA1 gene. If you have that gene, you then can have a special programs for cancer prevention and cancer surveillance. One thing that the members of the American Society of Clinical Oncology have done that work in the breast cancer community is they have very specific ways to follow patients and try to prevent cancer in that group. So most cancers, however, do not occur in families. The ones that do, we have these special programs for, but most of them are not familial. And the kinds of genetic change I was talking about earlier, these are not changes in your DNA. You can't pass this kind of thing on to your children. These are changes in the cancer cell, and only the cancer cell.
And how would you recommend someone newly diagnosed with the cancer go about choosing a doctor and an oncologist?
Well, I think I would urge you to do some good, as much information gathering as you can. Most hospitals and cancer centers now have websites that can tell you about the doctors, can tell you about the range of programs and approach. I think it's very important that no matter what you might read or what might be a doctor or institution's reputation, that you meet with the doctor and you make sure that there's that human bond there, that you find somebody that's going to work with you, that's going to listen to you, that's going to help personalize a plan of cancer care that makes sense to you. And I think we are very blessed in our country in having fine cancer care across the United States in large cities, small cities, rural areas, and it's just a matter of finding people that work with you. And I urge you to spend time and spend time with your healthcare team too, to meet with people, and ultimately make that decision based on the bond and the comfort level you have with that practitioner.
It's been stated that the society has become more open to encouraging new researchers. Does this include work with natural practitioners, those who work in the areas of homeopathy and acupuncture, for instance?
Absolutely. Cancer is a very complex disease, and the effects of cancer are extremely complex. And virtually every cancer center, my own included, I work at a large cancer center, has an entire program for complementary medicine and integrative medicine. I attended a session yesterday on the use of flaxseed to treat the hot flashes that are brought on by cancer therapies. We're really anxious to take whatever kind of treatment that can help people fighting cancer and put it to rigorous scientific tests. Actually, the flaxseed study showed that the flaxseed was not as effective. We weren't happy about that because we wanted to find another effective treatment. However, we have effective therapies, so rather than recommend something or use something that's not working, women can meet with their doctors and find out what are the effective therapies that make sense for them. So even the negative information was helpful there. But we are very open to do anything that can help people and help their families through the cancer journey and get them to that state where they're cancer survivors.
There's a hospital in Chicago that states how important it is to treat the human spirit. What advances have you made here in regard to cancer, and how are oncologists being trained in empathy?
Well, we're more and more paying attention to focusing on the entire range of issues that face cancer. I must say that when I started my career, cancer survivorship was just not something we thought about, because sadly we did not have a lot of cancer survivors. We've learned through the pediatric group that cancer can be cured. We've learned that survivors have special issues, and this came from our pediatric group. Actually, well, it's another wonderful observation at this meeting today, by the way, that in pediatric cancer, acute lymphoblastic leukemia, they've increased the cure rate once again. More than 80% of kids are cured of a deadly leukemia now. That data was reported yesterday. But the idea about survivorship is something I wasn't trained in, because we didn't have survivors. Now that we do, and I know our center and the ASCO organization is trying very hard to deal with survivors. We have established guidelines for survivorship care, and I think we're trying to spread them around throughout the oncology community. So we're all learning here, and we are very, very open to learn, and we just want to do whatever can be done to get people through the cancer therapy and change them from cancer patients to cancer survivors.
I'm speaking with Dr. Kris, ASCO, Cancer Communications Committee Chair. Thank you, Dr. Kris.
Thanks a lot, Bonnie.